In addition to increased nitric oxide synthesis, studies also demonstrate that calorie restriction substantially reduces your LDL cholesterol, your triglyceride level, and directly improves the function of your heart tissue and can be as effective as exercise. So some of the best exercise physiologists on the planet at Washington University, including John Halsey and Luigi Fontana, have demonstrated this in the research. They conducted a 1-year randomized control trial in middle-aged, lean, and overweight men and women to evaluate the effect of body fat reduction, either by a 20% increase in energy expenditure via exercise or by a 20% decrease in energy intake from calorie restriction. So the question they were trying to answer is, if you're trying to lose fat, because losing fat mass is known to improve metabolic health, what's a more effective way to do it? Do you increase your exercise or do you decrease your food intake? What they found was actually quite fascinating. They hypothesized that exercise would be more effective. But what they actually found was that their 12-month negative calorie balance experiment demonstrated that the calorie restriction group and the exercise groups both improved simultaneously, and both of them improved to approximately the same magnitude. Calorie restriction tended to be slightly more effective, but overall, 20% increase in exercising and a 20% decrease in calorie intake resulted in a significant improvement in many coronary heart disease risk factors. Now, you may not think that that's actually quite powerful, but the truth is that if you don't like exercising, or if you struggle with exercise, or if you are talking yourself out of performing exercise on a daily basis because you just never found a way to integrate it into your lifestyle, then here's the thing. If instead of exercising, which I am a strong advocate for, if instead of exercising, you simply reduced your calorie intake by approximately 20%, that right there would induce a number of similar metabolic benefits. Now, back when I was doing my PhD, research from my laboratory at UC Berkeley also showed that negative calorie balance can reduce what's called the global cell proliferation rate. And the global cell proliferation rate refers to the speed at which cells replicate. And when you can induce a reduction in the replication rate of cells, that means that the tissue itself turns over slower, which means that the rate of tumor incidences also increases slower. So you can see it in this study that we published back in April of 2011. We determined that inducing calorie restriction in animals shown in the white bars on the right-hand side of each of these bar graphs resulted in a reduced turnover rate in keratinocytes, which are cells in your skin, as well as hepatocytes, which are cells in your liver, as well as MEC, which are mammary epithelial cells, shown on the bottom left, as well as splenic T cells shown on the right. So we chose 4 different tissues and demonstrated that calorie restriction, or inducing a negative calorie balance, is effective at lowering the global cell proliferation rate in all 4 of those tissues. And if we went on to study more tissues, we would likely find a very similar effect, which is that the rate at which cells are replicating goes down, which means the rate of tumor incidence goes down, which means the rate of cancer development goes down. And who doesn't want that? Now, since being overweight dramatically increases your risk for the development of many cancers by increasing the global cell proliferation rate, weight loss that naturally occurs from being in negative calorie balance is one of the most powerful things that you can possibly do to reduce your chronic disease risk, especially when it comes to type 2 diabetes and cancer. So I just want you to understand that negative calorie balance is the gold standard. The question is, how can you induce negative calorie balance? Do I have to be hungry all the time, or can I perform it intermittently and get a very similar effect?